We're starting again. Good morning, everyone. Happy Monday morning. How's everyone doing? Good. Awesome. My name is Candace Prince-Modis. I am the campaign manager for the Menthols Kill NYC campaign. Yes, give it up, give it up. I stand here today with my community, with Borough President Vanessa Gibson, and community advocates and stakeholders to call on the New York State lawmakers and our city council to pass common sense restrictions on the sale of menthol cigarettes in New York State and New York City. Big Tobacco, for decades, has aggressively marketed easier to smoke and harder to quit menthol-flavored cigarettes to children and African Americans in New York, killing thousands every year. African American cigarette smokers are nearly 11 times more likely to use menthol cigarettes than white smokers. And in New York City alone, 85% of black smokers use menthol, compared to only 23% of white smokers. So what we're talking about here is prioritizing the health outcomes for black New Yorkers. It's time to prioritize black lungs. It's time to prioritize black lives. Right? Every other flavored cigarette has been banned in New York City's retail shelves, except for menthol. Except for menthol. Let us be clear that this is no accident. It is the result of the tobacco industry's deliberate efforts to maintain their profits, their fat pockets, right? At the expense of my life, at the expense of my community's lives. Our legislation, Intro 577 in the City Council, would end the industry's loophole for good in New York City. And while we're at it, let me also clarify one more thing. This bill will not criminalize the use of menthol cigarettes. Once the restriction is in place, we know that lawmakers who are currently working to amend the legislation now to make it clear that only those who are illegally selling menthol cigarettes will face penalties. But those who continue to use it, and we know that folks will continue to use it, those are not the folks being targeted here. We are not trying to infringe on anyone's personal rights. We are not trying to take anything away from anyone. We are here to extend the livelihood, to extend the quality of life for our black and brown New Yorkers. So you will hear from many of our community members today, our advocates, right, who are going to talk to you about their personal stories, their impact that menthol cigarettes have had on their lives, and why they support this legislation. So without further ado, I am going to bring up one of our hosts for this morning, none other than our wonderful Bronx Borough President, Vanessa L. Gibson. Give it up for our Borough President. Give it up, give it up.
Thank you so much, Candace, and good morning to each and every one of you, to all of my colleagues in government and brothers and sisters in this movement. Welcome to Bronx Borough Hall. I am grateful to be here with you, not only as your borough president, as your ally, as an advocate, and someone who is proud to stand with all of you in this important endeavor. I am grateful to join our coalition, a diverse statewide campaign of civil rights organizations, health educators, advocates, NAACP, faith leaders, public health organizations, advocates, and many who have been affected by the impacts of menthol, to be here to stand with all of you as we officially ask for this ban to take place. Menthol-flavored tobacco products. I want to recognize that this proposed ban was recently endorsed by the New York Daily News editorial board just last week. They agree with us. We don't always get agreement from the New York Daily News, but we are grateful that they agree with us in this regard. And as Candace has said, big tobacco companies have traditionally and historically targeted communities of color and age residents in our communities, disproportionately impacting our children and our families and their livelihood. It is unacceptable when you think about the impact that menthol-flavored tobacco products has had on our communities of color. It has been the source of high rates of asthma, heart disease, obesity, and so many other ailments that are completely preventable in our communities. We have seen that just in New York State, menthol cigarettes are used by over half of all of our adult smokers, 86% of African American smokers, and 72% of Latino smokers have smoked menthol tobacco products. Now, we've seen surveys, 62% of Americans support a ban on menthol, including 2/3 of African Americans. Half of our young people that we surveyed between 12 and 17 who have ever tried smoking, guess what, have started with menthol cigarettes. As it was mentioned, the City Council, led by City Council member Rita Joseph, and 19 members of the City Council, also in conjunction with our office, the Bronx Borough President, Brooklyn Borough President Antonio Reynoso, and Manhattan Borough President Mark Levine. We are proud to support Intro 577, which would amend the administrative code of the City of New York in relation to prohibiting the sale of flavored cigarettes. We stand with all of you, with all of our advocates who are here today. I also want to recognize Arc of Justice, Miss Abby's Kids, as well as the American Cancer Society, Public Health Solutions, Black Spades, and the People's Assembly, who are standing with us today. And you will hear from this morning. Big Tobacco has spent decades exacerbating systemic racism. Menthol-flavored tobacco products are even more addictive than non-flavored products because of the mint flavor that it contains. Now, here in the Bronx, we have the second highest percentage of both adult and teen smokers in the city of New York. So this is very personal. That is why I am proud to join this effort, because we know that if we banned menthol-flavored products, thousands of smokers in the city of New York would stop tomorrow, not to mention the thousands more who would not even pick it up in the first place. So we want to be preventative and not reactionary, and we want to stop this in its tracks today. This is a call to action and a call to attention, and guess what? This is about saving lives. Saving the lives of Black and brown New Yorkers across this state. We have an opportunity, a unique opportunity in this state at this moment, with this legislative body led by Governor Kathy Hochul and our legislative leaders in the Assembly and the Senate to do what is right for the people of this state. We can't talk about it, but we have to be about it. If we want to save lives, we need to do it and not delay anymore. Our children need us with so much that our children have to endure every day. The plague of gun violence, traffic violence, domestic violence, so much that our young people have to endure. We want to lessen their burden and uplift them and give them the fruitful, productive lives, the healthy lives that they rightfully deserve. And so it is time to ban these products to protect the health and wellness of African American and Latino New Yorkers and all of our communities, and stop this in its tracks today. I want to say thank you to all of the advocates. I have watched you work over these last several weeks at town halls and demonstrations and press conferences, standing up for what is right, not what is popular, but what is right. Because there's two different things. What is right is not what's popular. We're not doing this for a headline. We're doing this because our people are dying. Our Black and brown brothers and sisters are dying. And if we can do something about that, to change their trajectory, to give them a brighter, healthier future, then guess what? That is what we will do. That is what we have all been called to do. With all these titles, we are human beings, and these are our brothers and sisters, and we care about our neighbor, because when one of us wins, all of us will win. So that is why we are here, calling on our leaders to stand with us in this ban, stand with us in protecting black and brown lives, and giving our young people the support that they rightfully need to live healthy and productive lives in our borough, in our city, in our state. I stand with you. Let's get this done.
Yes. Give it up once again for our borough president. So as we mentioned earlier, we are not simply a mishmash of talking heads coming in telling folks how to live their lives, what they should be doing, what they should not be doing. This is a community telling their legislators, telling their lawmakers, we do not want this. We do not need this. So you're going to hear from your community today. So first up, we have Shaniqua Charles. She's the executive director and founder of Miss Abby's Kids. Shaniqua, please come up.
Peace to the family. I said peace to the family. We're here today not asking permission. Let's put that mystery to bed. We are not here today begging and pleading, say, can you please do this for us? What we are here today saying is that we have uncovered the science that proves that the tobacco industry intentionally created a weapon against black folks. Yes, yes. Created something that they knew would take our lives disproportionate to everyone else. Now let's break down of some of that science. Are you with me on this? When you combine nicotine and menthol in a cigarette, it lasts nearly 80 times longer in a melanated cell. For those of us who may not be familiar with what a melanated cell is, let's break that down a little further. A melanated cell is what gives us our color. A melanated cell is what physiologically determines us to be black and brown people. So if you have agency that says, let's create a product that is specifically targeted to brothers who are black and brown because it will cause cancer, because it will cause emphysema, because it will give you lung disease, because quite literally your skin will peel off your body before you died, like my mother's did at the age of 57 in my arms. That means that we have a target on our backs. Yes, yes. That means, and it sounds a little bit like domestic terrorism if you ask me. And so while we are here saying big tobacco, we have figured out what y'all did, that we are also coming to tell you that we're not going to take it anymore. I've never went to the store and looked for a cotton candy flavored anything. I'm not going to the stores looking for strawberry flavored anything. You're targeting our children, and we're on to you. See, you may have gotten my mother. You may have gotten my friends' mothers. But who you cannot have is our children. Who you cannot have is our babies. Who we refuse to let you get your hands on to cause death and destruction, pain, horror, and terrorism is our children. And so we have come together to this day, on this day and many other days, with groups that have been on the ground for years, with elected officials who understand the importance of standing behind something so important. And we're saying that we are building this table whether you pull up your chair or not. We're not asking for a seat at your table when we know that your sole purpose is to destruct and destroy black and brown people. Yes, yes? Yes, yes? I'm the oldest living woman in my family, and I'm only 43 years old. Let's sit with that for a second, and what the implications of that mean for my daughter, who is 13, who doesn't have a grandmother because big tobacco won their fight on her, because big tobacco won their fight with my grandmother, because big tobacco won their fight with my aunt. We deserve somebody to teach us about how to grow the food in the yard like my grandmother taught me when I was a baby. We deserve to have those elders in our families who teach us the things that keep us out of the street, like our history and who we are, and the fact that when we came over here, we didn't come over here as slaves. We came over here as lawyers. We came over here as doctors. We came over here as healers, and we were turned into and targeted in this very country. So again, we're not saying, please do this. Oh, I don't think, what? We didn't come here to say, please do this. We came here to say that you need to do it now, because it's about to get hot if you don't. Yes, yes? It's about to get hot if you keep coming after our babies. Yes, yes? You ever been in the jungle when a lioness gives birth to her children? Can you run up on them? Can you run up on them? What'll happen to you if you do? Shout it out. What'll happen to you if you do? You get tore up. And so, what we're saying here again is that we need for the legislation to be passed in the city council. How do you reckon with yourself the fact that you know something was intentionally created to kill black folks and you still stand on the other side? How do you know that something was created to annihilate an entire people of color and not do the right thing? My question for anybody who has the ability and the authority to make these decisions, what would you want your legacy to be when your story is being told to your grandchildren? All I want is for my daughter to make it to be a grandmother's age, because at the age of 57, you have not lived enough life to pass on your legacy. At the age of 57, you still have more years left that you can rear up these young babies and make sure they're not picking up guns. Rear up these young babies so that when you're in a neighborhood and communities like the Bronx, who are operating at number 62 out of 62 counties in all of New York State in a food desert without even enough fresh vegetables and fruits to keep your body strong, so that when things like COVID hit, that you actually have an immune system to combat those things. We are continually being targeted, and it's not just the menthol cigarette. It is in our food. It is our lackluster education system. It is the fact that our black and brown bodies fill the carceral state in a new age slavery. We have a host of issues that we have to acknowledge. And when they said, let's go ahead and make a super cigarette, as our brother Kirsten Foy says, the AK-47 of cigarettes, what he meant was you knew that you were taking our minds, because the menthol cigarette is more addictive than any other cigarette. For those who have never smoked a menthol cigarette, let's break that down for a second. You ever chewed a piece of gum that was spearminty minty with the menthol in it and then drank some water? It's a cool feeling. So when you inhale that cigarette, it cools the lungs and it allows you to keep the toxins and the things that cause your death and destruction in your body longer, and it feels nice. They told us back in the 50s and 60s that you'd be cool if you smoked these cigarettes, that it would be sexy if you smoked these cigarettes. And we have the science and data to prove that the marketing was intentionally targeted to black and brown communities and poor white communities. Now, why would you do that if you didn't have it out for us? That lynching bill went to the floor over 200 times before we got an anti-lynching bill. And that was because it was for black folks. We have witnessed other groups get what they need immediately. So we know that it can be done. Yes, yes. So we know that it can be done. Yes, yes. And so simply put, again, here today, what we are saying simply is that we're not asking for permission. We're not asking for permission. We are saying end menthol cigarettes in the city and in the state, because we do have access to get these things done immediately. And also, I want to leave you with this question for your own self if you are on the other side of this issue. What do you want your legacy to be when your story is being told to your grandchildren? That you stood up and did the right thing for people who built an entire country, or that you were more concerned with the money in your pocket? Peace to the family. My name is Shaniqua Charles.
Thank you so much, Shaniqua. So you've heard and you will hear personal stories, right? Anecdotal data about the harmful impacts of menthol cigarettes. But we also need the science, right? We need the medical data. We need medical advocates, partners to provide that hard data for us. Because we know in our heart of hearts, we know that this is not good for us. But sometimes you need to support that with facts and figures, with advocates who've done the research, who know the science and can support what we already know in our heart of hearts. So I do want to bring up today from the American Cancer Society, Michael Davoli.
Thank you. So I have to say, following up Shaniqua and the borough president, I am very self-conscious right now. So I'm not nervous. I'm just full-blown self-conscious. So I'm going to talk a little bit of statistics. I'm going to talk some facts. So for decades now, the tobacco industry has argued about all of the horrible things that will happen if we get rid of tobacco. They've talked about how if we end the sale or stop allowing tobacco to be used in bars and restaurants, then bars and restaurants are going to close. If we stop allowing people to smoke in a baseball stadium like Yankee Stadium, people aren't going to come to the games. They said if we increase the cost of tobacco, it's going to cause bodegas all across the state to close. They've said if we raise the age to 21, it's going to lead to this massive untapped illicit sales, and bodegas and stores are going to close. Year after year, proposal after proposal to end the sale of tobacco and to curb the use of tobacco has been met with resistance from the tobacco industry, with misinformation, alarming, and downright lies. So my question today is not what will happen if we pass this, but what will happen if we do not pass this law. So let's just break it down from the American Cancer Society's perspective, just cancer alone. There are 12 different types of cancer that are directly linked to tobacco use. We always think about lung cancer, but we don't think about the other 11 types of cancer that range from breast cancer and colorectal cancer and mouth cancer, oral cancer. There are 12 different types of cancers. There are 40% of all cancer cases are linked to tobacco use, and 30% of all cancer deaths are linked to cigarette smoking. And unfortunately, as Shaniqua said, there are widespread disparities in all of these health issues. If you are a black man, lung cancer is the leading cause of cancer that you face. If you are a black woman, it is the second leading cause of cancer. Statewide, lung cancer is the #1 cause of cancer deaths in New York. And we know that over 80% of all lung cancer cases are directly tied to smoking. So breaking the numbers down, over 16,000 New Yorkers will be diagnosed with a cancer linked to tobacco use this year alone. Over 4,000 New Yorkers will die from a cancer linked to cigarette smoking. That's just cancer. When you add heart disease and all of the other forms of chronic illnesses and diseases that tobacco use contributes, you're talking over 12,000 New Yorkers will die from a preventable disease if we get rid of tobacco. And statewide, over 28,000 New Yorkers will die from preventable death and disease. So when the tobacco industry talks about all of the horrible things that they say will happen if we pass this ban, with zero evidence to back it up, we must respond with, what's going to happen if we don't end the sale? Every single day, there are doctors all across the Bronx and across New York State, right here in Bronx and Montefiore. I work with a handful of docs that are working to treat patients that are dying from smoking-related illnesses. Every single day in New York State and right here in the Bronx, there are people like, where's Vanessa, who you're going to hear from in a moment. Vanessa, who are working every single day to help kids from getting addicted to tobacco and to helping adults quit. And every single day, there are people like myself that are going up to Albany or going to City Hall to help amplify the voices of Shaniqua and Candace and the borough president. But we can't do this alone. We need the city council, we need our state lawmakers to stand up to big tobacco and do the right thing. Because that's the ultimate question, is what will happen if we do not? And I think we heard that today from Shaniqua. We cannot have another family whose oldest living female is 43 years old. We must stand up to big tobacco, or else all of these statistics will just continue on year and year and in the future. So thank you all so much today. I'm inspired. I'm going to the Capitol after I leave here today to fight on behalf of all of you, and I'm so confident with all your back. So
Thank you. Yes. Thank you, Michael. Thank you, Michael. And again, we can't do this, of course, we can't do this alone, right? It's not enough to simply tell our stories amongst ourselves. We need to have facts, we need to have figures, we need to have our advocates in City Hall, in the state legislature, fighting on our behalf as well. And so, speaking of advocates, I would like to bring up Vanessa Dudley of Public Health Solutions. She's been out informing our kids, informing our communities of the dangers of cigarette use. So Vanessa, please come up and address us.
Good morning, everyone. Thank you again. I think I need to be loud. Everybody here was so loud, so I feel like I have to be loud now. But no, I think this is a really good opportunity to speak about the work and speak about what's going on. And it's really, really good to see so many people behind me and to have the support of the borough president who believes in what it is that we're trying to do out here and really to push forth on the education. So my name is Vanessa Dudley. I am the director of NYC Smoke-Free at Public Health Solutions. Public Health Solutions is the largest not-for-profit health agency in New York City that supports vulnerable New York City families in achieving optimal health and building pathways to reach their potential. Through their program, NYC Smoke-Free, we work to foster these environments supportive of policies that reinforce tobacco-free norms in communities throughout New York City. At NYC Smoke-Free, we work to educate about the dangers of tobacco use. We work closely with our youth through our Youth Action Arm Reality Check to bring awareness that big tobacco targets them to use these products that are harmful to their health. Many times what we hear from our youth is that they see these products in community, colorful products that look like candy and have been added with flavors that are used to entice and attract them. Tobacco companies add flavors to their products to attract more youth and teens, as well as to mask the taste of the product. These companies know that their products are harmful and dangerous to our youth, but find ways to disguise them and appeal them more to the younger generation. Menthol, as we know, is a green minty leaf. It is a product that is used to heal. Think about things like gum or mint or Vicks that you may have. Gum is something that's used to freshen your breath. Mint is something that you take when you're not feeling well in your tea. Or even think about your Halls or your Vicks that you take when you're not feeling sick. All of those contain menthol, and they're used to heal you. But when we see menthol in tobacco products in communities, it's confusing. How is it that a product that's supposed to heal is combined with a product that is deadly? Right? So yeah, that's exactly how they do it. In New York City, there's 2 out of 3 young teen smokers who start with menthol flavored tobacco product. The menthol flavor additive helps to match the harshness of that product. It gives a cooling sensation, it numbs the throat, so it's easier for the smoker to ingest. I hear from our youth who say they are tired of seeing these products in their community. They are alarmed because they know that the average age of a smoker is 13. In the Bronx, 1,000 public high school students smoke cigarette, and there's 6,000 public high school students who use an e-cigarette. These numbers are alarming, and they're going to continue to rise if we're not educating our youth properly about it and we're not getting the information out there. Our youth know that the more times they see these products in the community, the more opportunity there is for them to start using it. Students are alarmed because they know that a new smoker can easily be their friend, a relative, or a school peer, and they can get sick from using these products. Our students talk to their peers who started smoking because the tobacco product, and learn from them that they started smoking because the tobacco product had a flavor in it, and now it's harder for them to quit. They can provide the education, but when addiction has taken over, how do they help that friend or relative or school peer no longer fall prey to the flavors of the tobacco products? Thank you.
Thank you so much, Vanessa. So, and again, it is important, again, that we hear from our advocates, but that we also hear from community members, folks who've experienced personal loss, right? Financial, loss of life in their households, in their families due to tobacco use, in their communities, right? So we did think that it was appropriate that you heard from the community today. So I would next like to bring up Marion Frampton, AKA Tiny. Tiny. Tiny is the CEO and president of TBS New Direction, representing the Black Spades.
Peace and blessings, family. You know, they gave me this mic behind these two most powerful women behind me, Shanika and the borough president. So I'm gonna try to keep up with them. But here's something I think I can move a little forward, because I think I'm the oldest up here. You know, I was in here when they was promoting tobacco, when they used to go around and give out free cigarettes, and none of us knew the repercussion of what we know today. And I am one of those survivors who would go because I wanted to be cool with the girls. I wanted to be able to hang out and put these cigarettes in our pockets, and they gave it to us for free. And they didn't do anything but just give it to us and raise the prices over and over and over. You heard Shanika say something that was very important and it hit me. I've lost too many brothers and sisters to tobacco. A lot of my brothers and sisters who are spade comrades died from cancer. I have 4 or 5 who didn't even smoke, but because they was around the smoke, they died. When are we gonna stop? And you know, I can't say back then we knew, because we didn't know. We didn't know what was gonna happen today. But we know today, and today, like Shaniqua said, and the borough president said, we have to make a difference. Because if we want our children to go ahead of us, then we got to fight for them, and we got to inform them, you understand, about these cigarettes, this menthol smoke, because the tobacco company don't care. We got so many different things that plagues our communities that when they handed us this tobacco, we didn't know it was gonna be a plague. We thought we was hanging out having fun. But I can count the lives, actually I can't count the lives that I have lost in my family alone, my Black Spade family and my brothers and sisters, my siblings, who have lost their lives to cancer. We got to fight, and we got to fight, and we got to stand up and fight. We got to fight for so many different things. And every day that we stand up and we fight, another thing is added to our plate. But this tobacco and the gun violence, we must fight even harder for both of these, because as far as I'm concerned, one is a gun in the mouth and another's a gun in the head. And it's killing us. And it's killing us. And we need, like Shamika said, we're not asking, we're demanding. We're not asking for anything any longer, because you know what? Black lives do matter. But it doesn't matter to go out there and fight for it, but it matters for us to stand up here like each and every one of us are standing here today, you understand, and talk about it. But we got to be strong enough to talk about it, and we got to be strong enough to stand up and say what we're going to stand and what we're not going to stand. And right now, we're not standing for no more of these menthol cigarettes in our community. You targeted me, but you won't target my son. And that's why we're here, to make sure that you don't target our family. And like I said, behind these two women, boy, they gave me a run for my money. So all I could do is say what's true. And what's true is that I've seen so many lives lost, family and friends, to this tobacco, cancer. And you know what, though? Some of them, before we even stood here today, half of them don't even know what they died from. They just knew that they died from cigarette smoke. Not that they learned that later on in life, it would become an epidemic that would destroy the black and brown communities because they targeted us. They targeted us because listen, let's put it in there. It's like experimenting. Let's give it to them, which they wouldn't do to someone else. So I stand here with my brothers and sisters and with each and every group here today to say, we need to fight. We need to fight hard, not just in here, not just with our politicians, but we need to fight with the rest of the world, because it's like if we don't stand up and fight, who will? And I know one thing, I want my children to survive. Thank you.
Thank you, Tiny. Give it up, give it up. You know, as he was speaking, it occurred to me that when I see those who oppose our efforts try to play on people's emotions, on people's fears of what will happen if we were to enact these pieces of legislation, when they try to scare us into what may happen if you introduce additional bans and so forth, and then they try, playing with people's emotions, as if there isn't emotions on this side, right? As if people haven't suffered loss, right? Financial, otherwise. There's a ton of emotions on this side dealing with what folks have to deal with when you see family members literally dying, whittling away in front of your eyes over something that's preventable, right? Preventable. So I do want to make sure that we hear from a few more people as we begin to wrap up. We do have with us, I'm so happy to have her here, Miss Bridget Brantley, founder of the People's Assembly. Bridget, come on up. And with Bridget, to close us out, because I always tell folks, when we're talking about improving the quality of lives for our young people, we can't talk about young people if we don't have young people in the room. If we don't hear from young people and let them tell us themselves how they feel. So with Bridget, we do have Ms. Harmony Bass, and she will also help close us out this morning.
Peace and blessings, everyone. So my name is Bridget Brantley. I am the founder of the People's Assembly. I am also the Dream Coach at Democracy Prep Endurance High School. Dream Coach is another way of saying the dean. So I'm gonna try to make this quick and swift. Of course, right, we gotta assemble the people. This ban is personal for me. I had a grandmother who was an avid smoker, watch her stories, and we would go to the store. And then I realized even my aunts and my mom were smoking cigarettes at the age of 12. Now, this is way before me, so I guess at that point in time, that was a thing that was okay. But then I'm realizing, like, I lost my grandmother to Alzheimer's. But she also was diagnosed with breast cancer, which I believe was probably because of the cigarette smoke. The People's Assembly, like many other organizations and public health advocates, support the menthol ban in New York City, especially in the Bronx, because menthol cigarettes have been marketed aggressively to communities of color for decades. This has resulted in higher health issues like cancer and heart disease in those communities. The People's Assembly believes that by banning menthol cigarettes, we can help reduce smoking rates and improve the overall health of communities of color in the Bronx and throughout the city. We support this ban as a part of a broader effort to address health disparities and ensure that everyone has access to the resource and support they need to live a healthy life. I'm going to turn it over to my young lady, Miss Harmony. Happy Women's History Month, by the way. All right, Harmony, go ahead.
I'm gonna.
Go ahead.
Okay. My name is Harmony Bass. I attend Democracy Prep at Durns High School as a junior in the future class of 2024. Today I will be talking about the topic of menthol and how it affects the young generation and furthermore the future generation. Many people have also experienced smoking, the negative health effects of smoking either directly or indirectly through family members or friends. They understand that smoking-related illnesses disproportionately affect people of color and they want to take action and help address the health disparities in their communities. Overall, the youth support the menthol ban in the NYC because they believe that it will help and protect the health and their well-being of their communities, especially those that have been hysterically targeted by the tobacco industry. They have seen how important it is to take a step to create a healthier life for them and both their future generations. Thank you.
Great job, great job. Give it up for Harmony, give it up for Bridget. Thank you so much. So as we close out, I just want to reinforce a few points that have been made already. So currently, there is a bill in the City Council, Intro 577, that will, when enacted, restrict the sale of menthol cigarettes in New York City. So the legislation, as it relates to enforcement will solely fall under the auspices of the Department of Consumer and Worker Protection. They currently issue fines to retailers who sell tobacco products that are currently banned, and once this goes into effect, they will continue to do so as it relates to menthol cigarettes. The police department does not enforce this matter. They don't currently enforce these rules, and they will not enforce these rules moving forward. So we expect our New York State lawmakers to do the right thing and also enforce a restriction on the state level, but we can't wait on New York State. We're also demanding that our city legislators act as well with Intro 577. So every day that we wait to pass this bill is another day that Black and brown New Yorkers are suffering, that their quality of lives are diminishing right before us, that our families are left to mourn their deaths or their eventual deaths, right? That our children are growing up without their family structures intact. And so we must end the sale of menthol cigarettes in New York City and New York State. We must prioritize the health of Black and brown communities, right? We need to do what's right, and we need to pass this legislation now. Thank you so much for joining us this morning.
I want y'all to look at this banner of some of the lives that we lost from Miss Abby kids. There's a picture of Miss Abby, my mother, my father, and my best friend, pictures up there that died from cancer. And I remember her and I started smoking when we was 10 years old. Get dizzy, go to sleep, and wake up. We didn't know any better. We grew up knowing that smoking was supposed to have been cool. But we're going to protect our babies today, because when you know better, you do better. And we know better through the scientists that we're going to stop this targeting of our children. We couldn't save this, the last couple of generations, but we're going to save this one. And this is a really art of work. There's too many people had died that wouldn't even make it on this banner. So we're going to stop this today. And I'm really hoping that they put this in the budget and ban menthol cigarette today. Thank you.
Thank you, everyone.